Good Thursday morning. Welcome. We are going to continue our training on trauma-informed care. Last week we talked about what trauma is, and then we touched on complex trauma, and hopefully you were able to watch all of the videos and learned about complex trauma through Patrick Willis. Patrick was the linebacker for the San Francisco 49ers, and he experienced childhood trauma. So today we're going to continue with childhood trauma, and we are going to talk about why does childhood trauma matter. What happens to us in our childhood affects our physical, emotional, and social development and well-being into adulthood. So I'm not sure if you've ever heard of the Aces study, but we're going to talk about the Aces study today. And the Aces study, ACE stands for Adverse Childhood Experience. Let me just put this disclosure out here today. Today we're going to get into some nitty-gritty stuff. Another warning to make sure you take care of yourself, because today we're going to talk about specifics of things that happen in our childhood that can adversely affect our ability to make good choices. And so if you need to step away, please step away, take care of yourself. Just want to give that self-care alert to you today. When I first heard of the ACEs study, I went through the study, read through the questions, and I thought, oh my goodness, there is no way that we can ask these type of questions to kids. And I got really confused about what the purpose of the ACEs study was, as far as how we used it in the school system. After asking several questions, I later got clarification. This is not a questionnaire that you give to students. Like, you wouldn't ask these questions to students. Basically, this is a study that happened in an obesity clinic in California, and it's probably one of the most important studies that have ever taken place. And in that, it was completed by or studied by a physician named Dr. Vincent Folletti, and he went through, I'm going to tell you the history of his study and how the Center for Disease Control came into the picture, how that they became intrigued by his study, and how we now use the ACEs study to help us in the field of mental health. So you may have heard of the ACEs study and you may not. I'm going to go through some slides, and I feel like that the history of this study is so important for you to know. It's a little long, and I'm going to be honest, it's a little long, but it helped me so much more to know all of these details and the specifics of it, rather than get somebody giving me a summary. So I feel like if it helped me to understand it, that it's going to help you. So I'm going to go through this study and tell you about it. Now, the source of this study, of the history, comes from acestoohigh.com. This is where I pulled this information from. And when I read this, I was so intrigued by it that I couldn't stop reading. So today I'm going to do the best I can to make an article interesting as I read it to you. So just bear with me. As I told you, it originated in an obesity clinic in a quiet street in San Diego, California. It was 1985, and Dr. Vincent Folletti was mystified. He was the physician and the chief of the department at the preventive medicine in San Diego, California. He couldn't figure out why. Each year for the last 5 years, more than half of the people in his obesity clinic dropped out. Although people wanted to shed as little as 30 pounds, that they could participate if they just wanted to shed 30 pounds, The obesity clinic was designed for people who were 100 to 600 pounds overweight. Every year, more than 50,000 people were screened for diseases that tests and machines could pick up before symptoms even appeared. So we're talking about 1985. This is when this happened. It was the largest medical evaluation site in the world. It was reducing healthcare costs before reducing healthcare costs was cool. He had a 50% dropout rate in his obesity clinic, though, and that started in 1985. And so it was driving him crazy. Like, why was half of the people in his clinic dropping out? And so he started to do a review of all of the dropouts' records, and it astonished him. These people, that they'd been losing weight when they left the program and not gaining weight. And so to Dr. Folletti, it made no sense of why these people were dropping out. Why would people who were 300 pounds overweight and they had lost 100 pounds, why would they drop out when they were on a roll? And so the mystery of this turned into 25 years of research. It was a quest involving researchers for the Center for Disease Control and Prevention and more than 17,000 members of this care program. It would reveal that the adverse experiences in childhood were very common, even in the white middle class, and that these experiences are linked to every major chronic illness and social problem that the United States grapples with. And we spend millions and billions of dollars on this. But in 1985, all that Dr. Folletti knew was that the obesity clinic had a serious problem. He decided to dig deep into the dropout medical records, and this revealed a couple of surprises. All of the dropouts had been born at a normal birth weight. They didn't gain weight slowly over several years. This is him. He says, I had assumed that people who were 400, 500, 600 pounds would be getting heavier and heavier year after year. In 2,000 people, I did not see it once, said Dr. Folletti. When they gained weight, it was abrupt, and then they stabilized. If they lost weight, they regained all of it or more over a short period of time. But this knowledge brought him no closer to solving the mystery. So he decided to do face-to-face interviews with a couple hundred dropouts. He used a standard set of questions for everyone. For weeks, nothing unusual came to inquiries. No revelations, no clues. The turning point in Dr. Folletti's quest came by accident. The physician was running through yet another series of questions with yet another obesity program patient. How much did you weigh when you were born? How much did you weigh when you started first grade? How much did you weigh when you entered high school? How old were you when you became sexually active? How old were you when you were married? I misspoke, he recalls, probably out of discomfort in asking about when she became sexually active. Although physicians are given plenty of training in examining body parts without hesitation, they're given very little support in talking about what patients do with some of these body parts. So instead of asking, how old were you when you were first sexually active, I ask, how much did you weigh when you were first sexually active? The patient, which was a woman, answered, 40 pounds. He didn't understand what he was hearing. He thought he misspoke again. So he asked her again, and when she gave the answer again, she gave the same answer, burst into tears, and added, it was when I was 4 years old with my father. He suddenly realized what he had asked. I remember thinking, this is only the second incest case I've had in 23 years of practice, he recalled. I didn't know what to do with that information. About 10 days later, I ran into the same thing. It was very disturbing. Every other person was providing information about childhood sexual abuse. I thought, this can't be true. People would know if this were true. I mean, someone would have told me this in medical school, worried that he was injecting some unconscious bias into the question. He asked 5 of his colleagues to interview the next 100 patients into the weight program. They turned up the same thing. Of the 286 people whom Fileti and his colleagues interviewed, most of them had been sexually abused as children. As startling as this was, it turned out to be less significant than another piece of the puzzle that dropped into place during the interview with a woman who had been raped when she was 23 years old. In the year after the attack, she told Dr. Fileti that she gained 105 pounds. As she was thanking me for asking the question, says Dr. Fileti, she looks down at the carpet and mutters, "Overweight is overlooked, and that's what I need to be." During that encounter, a realization struck Dr. Fileti. It's a significant detail that many physicians, psychologists, public health experts, and policymakers haven't yet grasped. The obese people that Dr. Fileti was interviewing were 100, 200, 300, 400 pounds overweight, but they didn't see their weight as a problem. To them, eating was a fix. It was a solution. Like there's a reason an IV drug user calls a dose a fix. This was their fix. One way it was a solution is that it made them feel better. Eating soothed their anxiety, their fear, their anger, their depression. It worked like alcohol or tobacco or methamphetamines. Nothing or not eating increased their anxiety. It increased their depression and their fear to levels that were intolerable. The other way it helped was that for many people, just being obese solved a problem. Listen to this, guys. In the case of a woman who had been raped, she felt as if she were invisible to men. In the case of a man who had been beaten up when he was a skinny kid, being fat made him feel safe, because when he gained a lot of weight, nobody bothered him. In the case of another woman whose father had told her while raping her when she was 7 years old that the only reason he wasn't doing the same to her 9-year-old sister was because the 9-year-old sister was fat. So being obese protected her. Losing weight increased her anxiety, depression, and fear to levels that were tolerable. So losing weight increased their anxiety, depression, and fears to levels that made it intolerable. For some people, both motivations were in play. Fileti didn't know at this time, but this was the more important result, the mind shift, the new meme that would begin spreading far beyond this weight loss clinic in San Diego. It would provide more understanding about lives of hundreds of millions of people around the world who use biochemical coping methods such as alcohol, marijuana, food, sex, tobacco, violence, work, methamphetamines, thrill sports to escape intense fear, anxiety, depression, and anger. Public health experts, social service workers, educators, therapists, and policymakers commonly regard addiction as a problem. Some, however, are beginning to grasp that turning to drugs is a normal response to serious childhood trauma, and that telling people who smoke or overeat or overwork that these are bad for them and that they should stop doesn't register when these approaches provide a temporary but gratifying solution. Ella Herman was one of the people who participated in the obesity clinic, but she dropped out because any weight she lost, she turned around and regained it. Herman owned a successful child care center in San Diego. Herman said she was sexually abused by 2 uncles and a school bus driver. The first time it occurred was when she was 4 years old. She later married a man who abused her repeatedly, and then he tried to kill her. With the help of her family, she fled with her children to San Diego, where she later remarried. I imagine I've lost 100 pounds 6 times, she recalled, and then gained it back every time. Every time she lost weight, a man commented on her beauty. She became terrified and she began eating. But she never understood the connection until she attended a meeting at which Folletti talked about what he learned from the patients. At this time, Herman was just a little over 5 feet tall and weighed nearly 300 pounds. He had a room full of people, she said. The more he talked, the more I cried because he was touching every aspect of my life. Somebody in the world understands, I thought. Herman later sent a letter to Dr. Folletti. She says, I want to thank you for caring enough about people to read all of these charts and find out what's happening to all of us who are molested, raped, and abused in childhood. She wrote, I suffered for years. The pain became so great, I was thinking of jumping off the San Diego Bay Bridge. How many people have taken their own life because they had no program to turn to? How many lives can be saved by this program? Dr. David Williamson, an epidemiologist from the U.S. Center for Disease Control and Prevention, sat next to the perplexed Dr. Folletti at a conference in Atlanta, Georgia. Williamson was intrigued. Williamson invited Dr. Folletti to meet with a small group of researchers at the Center for Disease Control, where the group decided to do a mega study in San Diego. 26,000 people that came into the clinic at the Kaiser, I think you pronounce that Permanente, in San Diego. Over 17,000 were asked if they would be interested in helping us understand how childhood events might affect adult health. Of those people, out of the 27,000, 17,421 people agreed to help. So when we talk about this research today, we're going to talk about the 17,421 people. They created a survey, which is also known as the Aces survey. The initial survey began in 1995 and continued through 1997, with the participants followed subsequently for more than 15 years. Everything we published from that baseline survey of those people, says Anda, also, as well as what was learned by following those people for so long. When the first results of the survey were due to come in, Andy was at home in Atlanta, Georgia. Late in the evening, he logged into his computer to look at the findings. He was stunned. He wept. He says, I wept. I saw how much people had suffered, and I wept. This was the first time that researchers had looked at the effects of several types of trauma rather than the consequences of just one. What the data revealed was mind-boggling. The first shocker, there was a direct link between childhood trauma and adult onset of chronic disease, as well as mental illness, doing time in prison, and work issues such as absenteeism. The second shocker, about 2/3 of the adults in the study had experienced one or more types of adverse childhood experiences. Of those, 87% had experienced 2 or more types of adverse childhood experiences. This showed that people who had an alcoholic father, for example, were likely to have experienced physical or verbal abuse. In other words, ACEs usually didn't happen in isolation. The third shocker, more adverse childhood experiences resulted in a higher risk of medical, mental, and social problems as an adult. This is the ACEs questionnaire. There are only 10 questions, and every question is either yes or no. If you have a yes, you enter a 1 for that question. If you have a no, you enter a 0. Let's talk about each of these childhood questionnaires. So I'm going to skip through some slides because these are showing up as blank. So when I do my trainings on trauma-informed care, I like to do it with a poll. And what happens is that this poll, everybody downloads this app on their phone. It's called Poll Me. Okay. And they answer the question. And what happens is that the question is displayed up there, and as my audience answers the questions, the results are displayed up on the screen, but it's completely confidential. Usually my trainings include a group of educators. We're looking at district personnel, which would include superintendents, assistant superintendents, directors of special education, directors of curriculum instruction and assessment. We also have principals, classroom teachers, school counselors, school psychologists, you kind of get and as well as we have some family resource personnel that have been attending these trainings, bus drivers, bus drivers, lunchroom personnel, and assistants. So my audience typically is every person you can think of that is involved in the school system. So I've come to a point where I'm going to have to end the show if I can, because I'm going to skip through here. So this is a question, and this is when I was experimenting with my poll, and I'm the only person that answered this question. But you can see that the bar increases as people answer the questions, and it will tell me how many people have answered. So this is completely confidential. The only purpose that I have in doing this is that I want to know in my audience how many people have experienced an ACE. And so let's talk about these ACEs today for this training, because we're not interactive. I'm not able to poll you. And when I say that, we will not get to look at actual data. But if you were to use this training yourself, I would highly encourage you to do that, because what we found out in a room of educators is that educators that are highly qualified, that are educated, gone to college, completed college, most of them a master's degree and doctorate, could be on to a doctorate degree or other programs, have experienced multiple ACEs. And so I use this as a way to show people in the school system that we have ACEs, and that how it impacts us. This is not a them type thing. This is a us problem. It's not a them problem. It is an us problem. Okay, so let's talk about each one of the questions. And I'm going to go through here, and you can just kind of take this poll in your mind or write it down yourself and just to see how many ACEs you have. Number 1, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? So if your answer is yes to any part of that question, give yourself a 1. Did a parent or adult or other adult in the household often push, grab, slap, or throw something at you? Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or try to or actually have oral, anal, or vaginal sex with you? If your answer to any part of that question is yes, give yourself a 1, and that will be how you will grade yourself through each one of these. Number 4, did you often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other. Number 5, did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you? Number 6, were your parents ever separated or divorced? Number 7, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Or sometimes or often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or a knife? Did you live with anyone who was a problem drinker or alcoholic or used street drugs? Number 9, was a household member depressed or mentally ill, or did a household member attempt suicide? Number 10, did a member of your household go to prison? So then here's my slide where we added up the total for our ACEs. And so everybody was able to enter all of this data through the app on their cell phone, and we would talk about it. This is powerful. If you do this training for your staff, I would encourage you to use this app to do this for your staff. Completely anonymous. Nobody knows what happened or who it happened to. None of that information is displayed, but it is very powerful to see in a group in our school how many of us have experienced an ACE. So I'm going to go back and start my slideshow back again, because on the actual slideshow those polls show up to blank. So I'm going to start it back from here. All right, so going on to the scoring, the more ACEs you have, the greater the risk you have for chronic disease, mental illness, violence, and being a victim of violence. People have an ACE score of 0 to 10. Each type of trauma counts as 1, no matter how many times it occurs. You can think of an ACE score as a cholesterol score for childhood trauma. For example, people who have an ACE score of 4 are twice as likely to be smokers and 7 times more likely to be an alcoholic. Having an ACE score of 4 increases the risk of emphysema or chronic bronchitis by nearly 400% and suicide by 1,200%, guys. People with high ACE scores, are more likely to be violent, have more marriages, more broken bones, more drug prescriptions, more depression, and more autoimmune diseases. People with an ACE score of 6 or higher are at risk of their lifespan being shortened by 20 years. So I'm going to go through a few slides, and we won't spend a whole lot of time on every one of these slides, but what you see here in gray is a 0. So this is the ACE score. If your ACE score is a 0, 1, 2, 3, or 4, you can see the higher your ACE score is, the more you are at risk for antidepressant prescriptions. The higher your ACE score is, the higher the risk you are of being the perpetrator of domestic violence. That means your risk increases that you are the person of being violent to others. The higher your ACE score is, the higher you are the more chances you are to have become an alcoholic during your adult life. The higher your ACE score, the greater your chance is of smoking as an adult and later being raped. Look at that. So 4 or more ACEs means that you have a 30% chance of being raped later in life. And so they found a correlation with people who had been raped, that they had a large number of ACE scores. And so The higher your ACE score, the greater your chance is of attempting suicide. So this one is looking at teen sexual behaviors, and the higher your ACE score is, this talks about intercourse by the age of 15, and then teen pregnancy, and then teen paternity. So it looks like if you have an ACE score of 4 or more, that you have a 40% chance of teen pregnancy. And the higher your ACE score is, we're looking at absenteeism at work, serious financial problems, and serious problems performing your job. So what they found, ACEs are common. You would not believe how many people experience high numbers of ACEs, and how many people in a school or workplace have experienced childhood trauma. ACEs occur together. So chances are, if you have one ACE, you have more than one ACE. They are a powerful predictive of adult outcomes. Here, guys, listen at this. The effects of ACEs are strong across groups of people with different backgrounds. That means you don't have to be poor to experience a large number of ACEs. Many people who are wealthy, we're looking at socioeconomic status, we're looking at race, we're looking at ethnicity. It doesn't matter the color of your skin. ACEs are strong across all backgrounds, no matter what your background is. Some people are just able to hide their ACEs better than others. Okay, so how does an ACE impact school performance? So we know that traumatized children are 2.5 more times likely to fail a grade in school. They score lower on standardized achievement tests. They are more likely to have struggles in receptive and expressive language. They're suspended and expelled more often. I'm just kind of curious, do you have an idea of why that this might be happening? And they're most frequently more placed in special education. A lot of people who have a high number of ACEs do not know how to express their feelings. They do not know how to express what their thoughts are in an effective way. And they also perform poorly in school because they're not able to concentrate. They are focusing on what happened last night at home. They are focusing on what's going to happen when they get home from school that day. And so if you've ever come to school, and listen, I know we all have days where we have other things on our mind than what happens at work or school. And so I want you to think about a time when that's happened to you, that you come to school and you're there in body, but you're not there in spirit because you just can't concentrate. You know, if something's not going on well at home, then you're focusing more on that. That's what children do too. Our children do that. They're not able to concentrate on those multiplication facts or comprehending that what they're reading in their language arts class that day. And so because of that, they miss out on a lot of content. And then they slowly start to fall further and further and further behind. And we often place these kids in special education. You know, they fail in their classroom work and they perform lower because they've missed out on the content. So I want you to look at this slide. And this slide says adults only see the tip of the iceberg. So what I want you to think about is that as an adult, as an educator, when our kids come to school, we see the shell. We see the outside. We see how kids act. We don't see the inside. We don't see how kids feel. You don't see how I feel right now, and I don't see how you feel right now. So thinking about that, I want you to look up here at the tip of the iceberg. Looking at the iceberg, we're going to think about the iceberg being what you see. You see how they act. You see how they respond. But you don't see how they feel. And although you may have empathy, you can't feel what kids feel. So we only see the tip of the iceberg. The thoughts that are going on in their head are, am I safe? Am I loved? Am I capable? Do I belong? Am I part of this group? Do the other kids respect me? People don't respect me at home. Why would my friends respect me at school? Why would my teachers respect me if the adults in my home don't respect me? Do I have power? Guys, we all have the need for power, right? I mean, we all want to have some level of power. Am I secure? Am I safe? Am I included? Do people value who I am? And listen, if they're being abused or experiencing a trauma at home, they're probably not going to feel valued. Because if nobody values them at home, that feeling is going to carry over into the school setting, and they're not going to feel valued at school because of those trauma experiences. Do people understand me, and do I matter? These are thoughts and feelings that we don't see from these kids that experience trauma. Okay, so let's look at this chart. Adverse childhood experiences. Kids who have experienced abuse and neglect, and that can be psychological, it can be physical, it can be sexual. And kids that experience household dysfunction, which includes domestic violence, substance abuse, and mental illness, it has an impact on their childhood development. So, you're not going to believe this, but I'm going to show you. We're going to talk about the brain next week, and that's my most favorite part because it's amazing what trauma does to the brain. And there is evidence to show that it affects the brain. So we're going to talk about that next week. Okay, so these ACEs affect, we have neurobiological effects. It affects the abnormalities of the brain. They have brain abnormalities. We have the stress hormone dysregulation. We also have psychosocial effects where there's poor attachment, poor socialization, poor self-efficacy. And we also have health risk behaviors. We turn to smoking. We turn to eating and become obese. We turn to substance abuse, and we turn to promiscuity. What are the long-term consequences of this impact? Well, did you know that all of this is directly related to diseases like major depression, suicide, PTSD, drug and alcohol abuse, heart disease, cancer, chronic lung disease, STDs, and intergenerational transmission of abuse? That's the cycle. That when one person is abused, they abuse their children, that child abuses their children, that adult abuses their children, and the cycle goes on. And we pass it on down generation to generation to generation. And then it causes social problems. We have kids and families that are homeless. We have prostitution. We have criminal behavior. They're unemployed. They don't know how to maintain a job. Parenting problems, family violence, high utilization of health and social services. All of this stems from ACEs. So this diagram that I found on Pinterest, and I'm not sure who the author of this is, but I thought it was a good visual for you to see, is that here you can see at the beginning the adverse childhood experience. So if we have an ACE, it impacts the brain, and it affects our ability to regulate emotions, control our impulses, manage our behavior. All of that causes us to develop unhealthy coping mechanisms. We start drinking, we have drug use, and then before you know it, we have 6 or more ACEs, and then because we've made these poor choices, we have poor coping mechanisms, it shortens our life because usually the use of drugs causes us to, something happens. Either our body can't handle the drug use anymore, or, you get behind the wheel, have a car accident, and that kind of thing. So it shortens our life by an average of 20 years. Okay, so long-term effects of ACEs. The ACE study also provided more extensive evidence. Research from the ACE study also provided the link between why something happened to you when you were a kid could land you in the hospital at the age of 50. The stress of chronic childhood trauma, such as being hit regularly, constantly belittled or berated, watching your father often hit your mother, it releases hormones that physically change a child's developing brain. It is amazing to see. Not amazing in a good way, but it's wild to see that trauma has a physical effect on the brain. And we're going to talk about that next week. But I want to share with you what I mean by why something that happened to you as a child could land you in the hospital at the age of 50. And so my cousin, he married a lady that was abused as a child. Her father was physically abusive. He was emotionally abusive and sexually abusive to her mother. And I'm not sure the extent of how much abuse she endured. She shared some, not opened up completely with me about it, but I'm not sure if she experienced sexual abuse, but I do know she experienced physical and emotional abuse. She's mentioned some sexual stuff, so I'm not clear on all of that. But let me tell you how this impacted her recently. She had a child, and about 6 weeks after she had the baby, she started having these unexplained seizures that were landing her in the hospital. And so they kept doing CT scans, and they kept doing blood work, and they kept doing all of this research to see why is she having seizures. Does she have a brain tumor? And so every single thing was ruled out. And as they ruled it out, the ER physician, when she had the last seizure, he said to her, "Did you experience any childhood trauma? Did you experience physical abuse, sexual abuse, emotional abuse, lack of basic needs?" And her answer was, "Yes, yes, yes." And he said, "That is your problem. Your problem is that your hormones are trying to adjust. And for so many years, you have put this trauma, you've buried this trauma, and this trauma is still you have not dealt with it. It's undealt trauma. And as your body is trying to come back into your hormones are trying to balance, and everything's trying to get back to normal, your body and your brain does not know how to handle the trauma, and it's causing your seizures. And as somebody that's trained in trauma, I was able to say, yes, 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 yes. I believe that. There is so much truth to that. And so it took her a while to really understand it. And the family members were like, "There's no way that can contribute to that." But I've seen the research in the brain, and I'm going to show you the research in the brain. Yes, it can happen. It can happen, and it was wild to see it happen to a family member. That it came back because it was an undealt trauma, and so he recommended to her that she go get counseling and she deal with this trauma so that her brain could overcome this and it could heal from it. But at this point, it had not healed from the trauma that she experienced as a child. So we're going to talk about the brain. I'm going to show you physical evidence of how the brain or how trauma impacts the brain next week when we return. Thanks for watching, guys. I hope you have a great week, and I really hope that you're getting lots of good information from this training. Have a good weekend. Bye-bye.